Hello and welcome to Community Conversations. I'm your host, KK Konashiro. We all know good health is essential for regular school attendance and making the most of students' educational opportunities. But we also know the challenges of finding affordable health care and visiting the doctor regularly. The Fremont Unified School District and its partners are trying to help by bringing health care services directly to schools. And here to tell us more is Carissa Havlicek and Lok Chan from the Tri-City Health Center, and of course, FUSD Health Services Coordinator Cheryl Knight. Thank you so much for being here. So,
Thank you.
Cheryl,
Thank you.
how did this partnership start?
This partnership it's been 6 years since I came into district, and I started working with Tri-City Health Center during the first year that I was here. And there's been a few different folks that have kind of come through these positions, and of course we didn't have a mobile clinic right away. That just started last year. So we started out and just trying to figure out, I wanted to find out where we could send our kids, any of our kids, for healthcare. We have a lot of kids that come into district all the time from out of country and that kind of thing, and they need a home.
Right.
And we give they need to have immunizations to come into district, and so we needed a place where we could send them right away that was easy, accessible, and would take really just about anybody. And so they kind of came to me first, and we started building our relationship, and we, started doing meetings and that kind of thing, and then it grew into what we've got going now. So.
Okay. So how does this work? Does this mobile clinic have regularly scheduled dates at certain campuses, or how does this, do you only go to high schools? Do you only go to elementary? How does this work?
So right now we have a rotating schedule. So Mondays we go to a certain school, Tuesdays we go to a certain school, and it goes like that Monday through Friday.
But all schools are included, just not high schools, not just elementaries, right? It's the whole, across the board.
Currently we mainly serve elementary schools.
Oh, okay.
But any student can use the mobile.
Oh, nice. So if they're in the junior high school down the street and they know the mobile clinic's going to be there, they can check in and get some help. Okay. Now, for those of us who have never seen this fancy mobile clinic, if I'm walking into it, what can I expect to see?
So our mobile is equipped with 2 private examination rooms.
Nice.
And a waiting area as well.
Wow.
Yes, and each room has the tools and equipment needed to provide basic checkups, physicals, and immunizations.
As well as staff?
Yes.
Are they Tri-City Health doctors and nurses?
Exactly. So
Okay.
we're staffed by a provider, medical assistant, and healthcare associate.
Okay. If I'm a mom and my child is going to the mobile clinic, do I have to be there, or is the principal or the teacher able to assist the students with a note? I mean, how does this work? I don't know. I mean, my child was complaining about something and I'm at work. Do I need to be at the clinic with my child?
So right now, all the students that we see on our mobile, we have to have a parent consensual because a lot of the population we work right now is elementary. So that's why we have to get a parent consent. And a lot for our patient on the mobile right now is most of the time is accompanied by the parent because they're a minor, just in case that there are a history question that a 7 or 8 years old may not able to address. So yes, we have to have a parent accompany the children for services.
Because I think a lot of parents, I'll just drop them off. And it's like, no. Yeah, and usually most kids are not excited to see anyone in the medical profession, and only mom and dad can comfort that issue. So I think that's great. Now, at the mobile clinic, how do parents pay for this? Can they use their health insurance? Do they pay cash, or how does this work?
So we have flat fees. It's $20 cash for physicals and immunizations, and $30 cash for sick visits.
Which is very inexpensive.
Yes, in comparison to a lot of co-payments.
Okay.
Tri-City Health Center as well as the mobile do accept Medi-Cal.
Oh, nice. Okay. Now, should you get a student, like, say they just moved here from out of the country and they're not well versed in health issues, and the health issue is a little too severe than the mobile clinic can provide for, what happens then? Do you offer referrals? How does this work?
Right, so we can offer additional referrals and resources to either our Tri-City clinics or to additional agencies.
Okay, great. How's the parents' reaction about this? Are they excited? Are they relieved? Do they think this is great?
I would say many parents coming onto the mobiles do like the services there. It's a quick one-stop shop to get what you need.
Right, and they don't have to worry about making an appointment at the doctor's office, right?
Yes, and the feedback we get is very well because especially during student enrollment, a lot of time the parent or student missing some immunization, and we are within reach and accessible for everybody. So to the district, they can get referred to the mobile, and they get seen. We provided records, and they're able to start class a lot sooner than you have to get a doctor appointment that could take like weeks or months, depending on the availabilities.
Wow. Okay. So if you're going to an elementary school, everyone on campus knows that you're going to be there that day. Are you there all day or only for a certain length of time, or how does this work?
So we're there from 9 a.m. to 4 p.m.
So pretty much all day. So that should work with any parent's schedule should they have to come. If the parent comes with another sibling or their spouse, significant one that also should be checked out for something, can you also accept someone else in the family, or is it just for the child in that school?
We can see someone else. Right now we started the age range of 2 to 24.
Okay.
That's the provider's scope of practice. If someone outside of that age range needs services, we can schedule them an appointment at one of our Tri-City locations.
Okay. And if I'm the parent, do I make this appointment with the school, or do I contact them directly to make that appointment? Because I know they're going to be at the campus, or how does this work too? I don't know anything. Tell me, what do I need to know?
Typically they would call Tri-City, and we do accept walk-ins as well.
Okay, so I can call Tri-City Health Center because I know you're going to be on this campus for my child.
Yes.
Okay. Wow. And then I mentioned this earlier, but I think it's important that the parents watching this know that you have certain staff that drive this mobile clinic. It's not the doctors or the nurses driving it, right? I think it's important that they know that. And then how, when you first came up with this program, how did you choose which campuses to start with? How does that work?
We kind of looked at we worked together and looked at the community to see where some of our low economic families were. But even after, when we started this, this is our second year that the mobile clinics have been out, and we've done a lot of we meet a lot together,
Okay.
Tri-City and district office, and we have a working group also that meets 3 or 4 times a year, and it includes attendance clerks, office staff, principals, that kind of thing at all levels, and we talk about what works and what doesn't work. And so we've kind of
Triage that.
we worked around it a little bit too.
Okay.
So
Nice. I mean, if the parent already has a existing doctor, but they can't make it to that doctor, and they make an appointment with you, can you communicate whatever you've done to that doctor? Is that line of communication open between the medical fields?
Yes. So let's say if a patient already have a established primary care,
Yeah.
and for some reason they want to use our mobile services. I mean, because we are a federal qualified health center, and
Right.
our mission, we don't deny anybody or
Right.
we turn away anybody. So
And thank you for that.
thank you. So we do see them, and let's say if we find out that the child needs to have some sort of follow-up with their specialty, our provider will advise the parents, say that your child needs some sort of follow-up with the PCP or to the specialty services. Please connect them to your PCP, and as long as the parents sign the release of information, we can release that information to their
Normal doctor.
their primary care physician, so
Okay.
they can make
That's
a
good.
follow-up visit or recommendation to specialty services if this child in need for those type of services.
And I also want to make something clear to our viewers that should you have an emergency, the mobile clinic is not where you go. You
Correct.
go
Absolutely.
dial 911 and go to
Yes.
emergency.
Yes.
Okay,
Yes.
just want to make sure everyone understands
Yes.
that. This is just for normal incidences or immunizations, nothing of an emergency situation.
Yes.
I think one of the biggest services that they provide for the district is the immunizations piece.
Yes.
And coming from the department that I work here at the district office, Student Support Services, we do all the enrollment for elementary here. And so my staff in the department have the flyers, and when the parents come in with their students and they say, we don't have all of our immunizations, and they come from out of country or from out of state or whatever, we hand them the flyer and say, Tri-City Mobile is on this campus today, please just go on over there,
Yeah.
get your immunizations, come on back, and we'll finish up your enrollment process. So it works it's just a really smooth, and then that way, then if they don't have a physician, Tri-City can help them out
Yes.
in finding a home, or if they do have a physician, that immunization record and the documentation is handed to, because it has to come back to district for us,
Right.
it's handed to the parent and they have it for their records, and then once they do find their medical home, then they can take that information to them.
That's great.
And one thing that's really great about the mobile is that they have one of their folks that works on the mobile will actually provide them with information on getting enrolled in insurance,
Nice.
like with Medi-Cal and
Nice.
Obamacare and all that kind of stuff. So that's really nice if they're struggling with that, and they have translators and that.
I was wondering about that.
Absolutely.
Okay, yeah, because if I'm from a different country, I need help from my child. I'm not sure what you're saying to me.
Right.
You are able to communicate to them with the, okay, good.
Yes, we do have supporting staff that who speak multiple language. I think at Tracy Health Center we have like 21 different languages.
Yes.
But a lot of our provider or staff who speak Cantonese, Mandarin. I myself speak Vietnamese, Farsi, Hindi. So we do have supporting staff that can help to connect and help the parent and student navigate the healthcare system.
Nice. Now, how do you get the doctors and nurses to do the mobile clinic? Is it volunteer? I mean, it's a great way to get out of the office, to see the community, but do they sign up for this, or do you have staff that's scheduled mandatory?
So our staff is scheduled there. Usually it's a hired provider for the mobile.
Okay, that's good. Wow, this is amazing. Congratulations
Thank
again.
you.
Man,
Thank
you're just
you.
rocking our boat tonight. So what are the future plans for this? Do you expand into middle school and high schools soon? Or just elementaries? Have you thought that far?
Right now, because based on the need, we provide the certain school site, but the mobile is open to everybody. So anytime if you have a student from high school, a student from like across the town, and they need some sort of like immunization or sport physical, or need to
Right,
use
right.
the mobile for a simple sick visit, they are welcome. So it part one site, but it serves the whole district
Right.
as a whole.
That's great.
Yes.
And I want to show you guys off for a second. I mean, it's great that you have this mobile clinic, but Tri-City Health Center is also kind of a secret. You guys handle everything from whatever gender you recognize or, want to be considered with. You help families no matter what their economic, financial backgrounds are. You help eyeglasses now, because that's fairly new. I think you've had that for like 2 or 3 years now, which you didn't have that before. You do everything for the community, and I think this mobile clinic should just go community-wide. Would you work on that?
We have been working on it. What's kind of neat is Tri-City also has a huge mental health
Yes.
clinic and a lot of providers. And we actually this year,
Yeah.
last year, we, one of the high schools asked to have the mobile clinic. They actually have 2 mobile clinics. Their second mobile clinic come over and spend 1 day a week on Fridays to do mental health.
Nice.
And they fill the schedule every single week. And so now all the other high schools would like to have this mental health mobile clinic as well. And it's like they can't find the providers quick enough. So we're trying to build it.
Yeah.
And it's just trying to find the folks to man all of that, and then just getting the word out there that they're there.
Yeah.
So, and they also, besides the vision care that they've got, they have a huge dental, a beautiful dental clinic in the, is it the Irvington?
Irvington site.
Right.
Yes.
It's amazing.
They're a one-stop shop.
Yeah.
They really, really are. And then if they need to send out to specialty, then they'll send out to specialty.
Yeah.
Which sometimes that happens too. So.
Yeah.
Yeah. Hopefully not too much. But thank you so much. You guys are awesome. Congratulations on
Thank you.
another successful
Thank
program.
you.
Good job.
Thank
you
you.
so much. And from everyone here at Community Conversations, we appreciate you watching, and we'll see you next time. Thank you.